welcome everyone to this episode of the AOCPMR podcast. Today, we are lucky to have Dr. Alex Fogarty with us. Did I pronounce that correctly?
Yeah, you did a great job.
Great. So a little bit of an introduction. So Dr. Fogarty is currently the academic chief resident at the Washington University in St. Louis PM&R residency program. She will continue her education as a fellow in sports medicine in St. Louis as well. So welcome, Dr. Fogarty. And of course, I have to ask, did you also do undergrad and med school in St. Louis as well?
I did not, although there are many of my colleagues here who are lifers at Washington University. Certainly, that's a pretty familiar path. But for me, I'm actually originally from Canada, so I did some schooling there as well as internationally, and then in the U.S. and by some serendipitous way, ended up here in St. Louis.
Well, that's awesome. I'm excited to get into your journey then. That sounds exciting. So first of all, thank you so much for joining us and for taking the time out of your day. And so, yeah, let's get started. So before we jump into the more nitty gritty, all the physiatry stuff and details, let's sort of get into a little bit of your journey and background coming into PM&R. So as you know, it's notoriously, a small field. Everyone kind of knows everyone. So I'm curious, what was your journey into discovering PM&R?
Yeah, it's a great question, and I think it's really difficult to know how to get started with rehab if you don't have a foot in the door, or somebody that you know personally who's been through it as a residency program or otherwise. So, for me, going into med school, I knew I was always interested in sports medicine and orthopedics, but yeah, it was a little bit difficult to know exactly if that was the right fit for me. And I think during my rotations is really when that became obvious to me that a surgical specialty was aligned with my interests, but not my primary goal. For me, really, I enjoyed the time in the clinic with patients. And I also really enjoyed fleshing out that differential diagnosis to understand, what's the etiology of their pain or their musculoskeletal issue. So for me, that was really more a driving factor into choosing sort of a non-operative specialty where I could still pursue my interests in sports medicine. So PM&R was sort of a natural extension into that. And then I was lucky enough as a fourth year to be able to do some rotations in PM&R. I did 2 of them, and that was really helpful for sort of cementing PM&R as the ultimate path, and really exploring, the breadth of the specialty too, because at the end of the day, it's not just about sports medicine, it's about brain injury, neurorehabilitation, and all those wonderful things that this awesome specialty has to offer. So doing a rotation was really key in appreciating all of that other aspects of physiatry, which are really I think crucial to the patient populations that we serve.
Awesome answer. You really, sure. You really talked about the breadth of the field. And I think, so kind of a follow-up question with that, I think a lot of students do go into the way they discover physiatry. I can kind of speak personally from this, is an initial interest of sports medicine, orthopedics. So would you say in terms of deciding what field to go into, of course, try out the fields themselves, but would you say just like knowing whether or not you're interested in surgery is an important aspect of making that decision?
I mean, I think classically people always talk about, the main branch point in terms of decision-making for residency being, do you want to do something surgical versus non-surgical? And I found that to be true in general. I think I really enjoyed the procedural aspect of surgery, but I didn't really feel as much like intrinsic gratification from just doing as much procedurally and then having less opportunity, I guess, for that longitudinal follow-up. So for me, that was definitely the first branch point in terms of, finding the right specialty. I will say too, just because a lot of people are interested in sports medicine and think that that's a really awesome career path, which it is, clearly. I'm very biased, by the way, but yeah, appreciating, I think the breadth of physiatry is so important to figure out if it's the right fit, because at the end of the day, regardless of what subspecialty you ultimately choose in physiatry or just going into general practice, you're going to encounter kind of the breadth of the field, and you'll be serving patients who have a lot of neurologic diagnoses. So really being not only comfortable, but also just genuinely interested in that patient population, I think is really critical to succeed in PM&R residency, and I think is a helpful thing to contemplate for somebody who's considering PM&R as, hey, I have an interest in sports and musculoskeletal medicine, but how do I feel not only about that piece, but how do I feel about the rest of the field? Because the rest of the field, even if you subspecialize, is going to stay with you for the balance of your career.
Awesome answer. All right, and I'm looking down. I want to make sure we capture all these points. So I think you kind of talked about it, but was there any moment per se that you decided this is the field for me during medical school?
Yeah, I think it's tough. I can really appreciate it when, people come to me and say, I have no idea how I'm going to choose and decide what I want to do with the rest of my life. Because I was really sort of between a bunch of things up until the very last minute. I talked a little bit before about how, I had an interest in, orthopedics and sports medicine, and how that led me to do a rotation in physiatry. But I guess the part that I didn't mention was, as a medical student, I also fell in love with internal medicine, because I really loved, that the ability to really work on that differential diagnosis and really be able to, I think critically about these complex patient presentations. So for me, I had to do a couple rotations in physiatry to make sure that I felt like I could have that part of my interest kind of fulfilled. And I think the tipping point, I guess, was, this, when I was doing an inpatient rotation, actually, as a medical student at National Rehabilitation Hospital in DC. And, I was on the brain injury service, and we were really taking care of patients who I felt as though there was not a lot of other people who could appreciate the challenge of the experience that they were living. And a lot of medical providers were coming to the table with sort of the viewpoint of, okay, this person has this problem list. They have hypertension, they have, diabetes, they have all these things. Okay, let's prescribe medications to that endpoint. But at the end of the day, what struck me was that those patients, the only thing that they really cared about was, how am I going to walk again? How am I going to get out of the hospital? And functionally, how am I going to go home and live a life that has some semblance of normalcy? So I love that I could use my medical brain and my differential diagnosis skills to try to help solve those functional issues that really matter to patients. Not to say that hypertension and diabetes aren't critically important to success in that space as well. But I think that there was a lot of other people who were doing a super great job of managing those issues. And for me to be able to use, that skill set and apply it to something that the patients really care about, how can I walk again? How can I speak again? How can I, accomplish these daily tasks? I felt more rewarding in a way. And I just felt like there's less people who were willing and able to do that. So I think that was sort of the decision-making point for me.
That makes a lot of sense. So would you say that, like, your interest in internal medicine and making those differentials, has that, in your experience so far, has that interest sort of been satisfied with physiatry? Would you say that's pretty important in the field?
I think traditionally, people don't necessarily think of it that way. People think about people or patients coming to rehabilitation, and okay, they already have the diagnosis. So what are you actually diagnosing? And, there's a lot of that sort of mindset, I think, that I've experienced. But for me, it sort of goes back to what I was just explaining. If once you get out of the mindset of, I'm an internal medicine or family medicine doctor whose job it is to diagnose these common medical problems, and then you put your brain on and say, how do I solve this really like multi-system complex functional deficit that's preventing this person from going home? I feel like you can tap into those skills in a very rewarding way. And then in the world of sports medicine, I think it's much easier to understand the relationship between like traditional medicine and, kind of our workflow. Obviously, people are coming into our sports medicine MSK clinics with, a new presentation of something, and then you're doing your traditional kind of workup and physical exam and imaging and all that stuff, sort of in a more traditional sense. So there's definitely a way to kind of get that differential diagnosis fix and really to be able to use that part of your brain if that's something that you're interested in.
Awesome. Yeah, I love that mindset. I mean, like you said, you can really take all of your interests, but hone them all in on one thing. It's improving functionality of the patient and sort of using all of your medical education, everything, just to hone in on that goal. So awesome. All right, before we delve into specific interests, what kind of, broadly speaking, what are some interests you've developed in the field so far? Of course, sports medicine.
Yeah, I mean, I've always obviously been interested in sports medicine. I think for me, sports medicine is a relative term. I really, growing up kind of as an athlete and competing in alpine skiing at a high level, I was definitely appreciative of the journey that, athletes have to undergo to be able to be successful. So that was definitely a motivation. But I think since being a resident and I think appreciating that there are other people that we need to serve, not just athletes, just your everyday person who's coming in with back pain or knee pain or musculoskeletal pain. Spending more time with your more general MSK population, I think has sort of influenced what I do see as my ultimate career. I'd like to be able to not just optimize the performance of high level athletes, but also to help, your regular guy who's just trying to stay active and stay participatory in whether it's their goal to go to the gym or if they're just trying to run a half marathon or whatever it is, making sure that those people as well get the highest quality care and access to musculoskeletal treatments that can keep them ultimately healthy and at their ideal BMI and participating in sports, which is going to have all sorts of other health benefits, not just the physical ones that I've alluded to, but also the mental health benefits of being able to participate. So for me, it's not just about that athlete, but it's also about everybody else who's trying to be athletic and continue on a journey of basically being healthy. And I think that's something that we really need to continue to develop and foster, because it's one of the only ways that we know in medicine today to keep people out of the hospital is to optimize, their physical health through exercise. So whatever we can do to get people exercising, I think is a really worthwhile endeavor.
Awesome. And I think this is a great sort of segue into lifestyle medicine, which from what I understand is very much preventive, right? Preventing people from developing these things in the first place. So can you kind of give us an introduction? A lot of people don't know what lifestyle medicine is. So can you sort of give us a general introduction into lifestyle medicine?
Yeah, absolutely. So lifestyle medicine, generally speaking, is it's kind of a medical approach that tries to use, evidence-based, both behavioral and, traditional medical teachings to really optimize the health of people who have chronic diseases. So lifestyle medicine has been around for a long time. I think it's getting a little bit more attention lately, especially in the community of PM&R, where we have a lot of people coming in with a variety of issues, to our musculoskeletal clinics or otherwise. And a lot of those issues are very deeply interrelated with, for instance, their chronic lifestyle associated illnesses. So if I can give you an example, like a chronic lifestyle associated illness would potentially be, smoking or obesity or all these things that, unfortunately are super prevalent in our society and are intrinsically linked with all of your other medical, conditions that you might have. It's really difficult, for example, in, the work that I see on the day-to-day basis to isolate somebody's chronic back pain from their smoking history and from their, potentially challenges that they've had, maintaining, the ideal BMI. So, if we can take a lens whereby we're not just focusing on, that isolated chief complaint of, hey, this person has back pain, but you can look at it kind of more broadly and say, what are the things that are contributing to this person having back pain? Is it medical illnesses that I've mentioned underlying this, like obesity, smoking, hypertension? How is that, playing in? And what about psychologically? How is this person doing? Do they have a good support system? Do they feel as though, their pain is associated, say, with depression or things like that? And I think the role of a physician who has a lifestyle medicine inclination is to address all of those pillars, not just the chief complaint, if that makes sense.
That does make a lot of sense. Which I think is would you agree? It's a pretty good fit for physiatrists.
Yeah, certainly. I think it makes a lot of sense to I think have PM&R sort of at the forefront of this. And some of my mentors here at WashU have really pioneered the role of physiatry in lifestyle medicine. So that would be Dr. Heidi Prather, who now has left WashU and is working with the group over at HSS. Dr. Hunt, who's here at WashU, and Dr. Cheng. That group here, amongst others that, of course, it's a long list of people who deserve all the credit for sure. But I would say that group has really done an exceptional job in trying to show through the medical literature that there is a role for lifestyle-based interventions, specifically in the outpatient musculoskeletal world. We have data that supports its use in other spheres. So for instance, in patients with metabolic disorders, so diabetes and hypertension, addressing the whole patient with a lifestyle approach has been shown to really optimize their outcomes in terms of their, objective disease status. But it's the same thing that we're seeing here with our patients with musculoskeletal disorders too, is that if you address all of those other factors, people on average tend to do much better, and they tend to get back to being more functional and able to, again, participate in the activities that are important to them, whether that's sports or otherwise. So definitely big kudos to those, big, pioneers in our field who are really cementing, I think, the role of physiatry in lifestyle medicine.
Absolutely. And yeah, I have seen in the med Twitter world sort of a lot more circulating articles about lifestyle medicine, which is great to see. One more question. So sort of practically speaking, especially for residents who may be interested in lifestyle medicine, how do you go about, do you need a fellowship or specific training to get into it?
That's a really great question. So, I think there's this is a question I think that's sort of evolving, and the answer to this question is sort of evolving. So I would, if anybody's interested in lifestyle medicine, would firstly recommend that they check out the American College of Lifestyle Medicine, which has a lot of educational pathways that can help people become certified in lifestyle medicine. Pretty much anybody can become certified in lifestyle medicine, regardless of the residency, is my understanding. But there is a pretty intensive course that you do have to go through that does have a pretty strong medical bent to it, as you would imagine, seeing as we're addressing lifestyle associated medical illnesses. Certainly there's going to be a lot of internal medicine and family medicine sort of bent to it. But my understanding is by doing that course, you also are going to be very well equipped to manage and counsel patients on some of these issues that we maybe less commonly deal with as a main thing in PM&R. So that's definitely a good place to start. And probably in the future, I would imagine that, there will be some residency programs who might integrate some of this lifestyle medicine, coursework into their direct curriculum. But I'm not sure that we're quite there yet in PM&R, but certainly that's an aspiration I think some people have for the future.
Awesome. Great to know. All right. So sort of transitioning into pain medicine, which is another one of your interests. And this is sort of something near and dear to me. I have, people close to me who suffer from chronic pain. So I'm interested, what sort of caught your interest in pain medicine specifically?
Yeah, so I think pain medicine and musculoskeletal medicine to me are, along the same spectrum of disease, right? If you think about sports medicine, you're treating acute musculoskeletal issues all the way to people with chronic pain. They have, chronic musculoskeletal or, dysfunction that now has become maybe more centralized. So I think it exists on a continuum where we see these types of pathologies. So it's really difficult, for me to isolate, well, okay, you want to just practice sports medicine, or hey, you just want to practice pain medicine. I think it's a really, that line is very much very fluid, right? So ultimately, I think being able to leverage the skills of somebody who's very comfortable in the pain medicine space, in the sports medicine space, and vice versa, I think is only going to be a helpful thing for people who are interested in kind of that sphere of physiatry. So just to preface that answer, But yeah, I think, I definitely got interested in pain just again by virtue of seeing a lot of patients in clinic who again have these kind of overlapping pathologies. Maybe, their pain started in the context of some sort of sports injury or musculoskeletal injury that at one point was acute, but now because of some of these other factors, potentially lifestyle related or otherwise, now they're left with more of a chronic issue that's more difficult to manage and is starting to infringe, for instance, on their day-to-day function and maybe even their psychological health. So being able to, I think about, again, going back to lifestyle medicine, kind of the whole person and addressing everything kind of more holistically, I think is really, really helpful in both sort of that more sports medicine and pain medicine space. And as a resident, I've been fortunate enough to work with quite a few pain researchers here at WashU, Dr. Haratunian being one of them. And it's really exciting to see, all the advances in terms of clinical research and translational research that's been done in the pain space. And my hope is that as PM&R people, we can also leverage, that research that's mainly in the anesthesia pain literature and apply it as well to some of our patients who we see in the sports and musculoskeletal world and really try to bridge that gap.
Awesome. Is there anything exciting in that atmosphere in the literature that you see, coming up in the near future?
Oh my gosh, there's so much. Yeah, I think it really depends on what your interest is. I mean, certainly one area I think that's captivating a lot of people right now is the utility of biologics, and applying that for people who have, again, more maybe acute musculoskeletal or tendinous or joint pathology. But I think another really exciting place in the future is going to be, what can we do from a neuromodulation standpoint to really, optimize these people who have more chronic dysfunction, who have then failed, things like regenerative medicine and who are still hesitant or perhaps not surgical candidates and would not be eligible for like a joint replacement surgery or a spinal fusion. So I think, the neuromodulation space, the orthobiologic space is something that is evolving on a day-to-day basis. So it's can be challenging to keep up with the literature. So if that's an interest of anybody, I really recommend that they pair themselves up with a really solid mentor who can help kind of them navigate, the best places to look for the up-to-date literature in a specific area of interest, because like I said, it's pretty dynamic and changing on the day-to-day basis.
Yeah, and you touched on biologics, and I feel like that's funneled down to the med student level. I see so many of my pharm professors are like, guys, you need to know these biologics. Like this is the future of medicine. So I'm glad you touched on that. Awesome. So now transitioning into your specialty, which, by the way, congratulations on your recent match into sports medicine. That's exciting. So I know you've touched on it here and there, but what kind of made you decide to pursue a fellowship specifically in sports medicine?
Yeah, I mean, it's a really great question. I think one that I've been asked a lot. How did I make the decision to do sports medicine? I think, at the end of the day, it probably just boils down to my original interest in coming to PM&R, what we were talking about before with regards to, the satisfaction of really diagnosing something. And, a lot of my mentors here, I feel like, are really expert diagnosticians in the MSK space, and they leverage, technologies like ultrasound at the bedside and electrodiagnostics to really hone in on, as best as we can, really hone in on the etiology of the chief complaint. So that was something that was really appealing to me. If I was going to do a fellowship, I knew that I wanted to come away with something more tangible. So to me, spending a little bit of extra time, really learning, the things that are kind of the extension of the physical exam, which is, more on the ultrasound and electrodiagnostic stuff, to really help cinch that diagnosis. That's really where I wanted to invest my time. Not ruling out doing a second fellowship in the future. You never know. But certainly I think for me, thinking about the way that I would like to ultimately treat my patients is to be able to be as precise as possible with the diagnostics that I'm doing, to be able to really use that information to both empower the patients and also to inform our treatments. And it's not to say that pain physicians don't do that. There can be wonderful diagnosticians. I think I was just really impressed with especially here at WashU, the people that I work with and how incredible they are at really pinpointing down that diagnosis, and that, you often, as I'm sure you've seen yourself, are motivated by and influenced in your trajectory, your personal trajectory, by the people who surround you. So I think it ultimately just boiled down to that too.
Absolutely. So there's a strong interest in St. Louis in sports medicine. Good for everyone to know. And you talked about the importance of diagnostics and ultrasound. This is kind of a personal question, but I know that many students also have this question because I see it circulating around all the time, is getting kind of that early exposure to knowledge in ultrasound. Would you say, in your experience, that residency is enough, or is there any way you would recommend people to get an early start?
Yeah, that's an interesting question. I think regardless of, firstly, regardless of your interest in PM&R, whether it's neuro rehab, whether it's pain, whether it's sports medicine, whether it's peds, ultrasound is going to be a technology that's going to be around to stay. I think that's pretty clear at this point. Even going back like 5-10 years ago, some of my mentors were, oh, well, this is a new technology, but let's see how long it actually is going to be around. And maybe just like a lot of other things, it'll come in and out of favor, and maybe, it's not really useful to invest a lot of time. I mean, I think by now we know that ultrasound is sticking around. So it's definitely worthwhile getting, familiarized with it. And I would say residency is a great time to do that. The thing that's sort of underlies the use of ultrasound, which is something that we kind of get hammered in our brains a lot, is your knowledge of anatomy. So as a student, and honestly as a resident too, probably the best investment of anybody's time is to really make sure that you become that expert at musculoskeletal anatomy. So everything from, your peripheral nerves all the way down to, the innervations of like all of the skeletal muscles, basically, and trying to develop in your mind a 3D model of what like an arm looks like versus what a leg looks like. Because once you have that model in your brain, and once you practice it enough that it's there to stay and it becomes fluent, then doing something like applying, new technology like ultrasound to look at that, it's going to make it so much easier. It's much more difficult to do the opposite and say, come to residency and having forgotten all of your anatomy, like, maybe myself and some other people that I know, and then you have to rebuild that anatomy knowledge really before that ultrasound becomes useful to you. Because otherwise you're just looking at this more convoluted version of something that you can't remember, right? So making sure that you come to the slate whenever it is that you're going to be really picking up that ultrasound curriculum for the first time, and knowing that anatomy is going to set you leagues ahead, from your colleagues. And I know it sounds basic and kind of annoying, but it's the truth. It's something that I think we can't practice enough. So there's definitely courses that you can take in, AOCPMR and AAP. They always are doing educational modules on the use of ultrasound. And there's always courses that you can go to, especially at those conferences, and practice scanning. I think those are great ideas just to get, familiarized with it. But in terms of like, a true investment of your time, I would just spend that time becoming an anatomy expert.
Awesome answer. Yeah, I think that just absolutely makes a lot of sense, which might be a nightmare to a lot of medical students. I feel like anatomy is a split topic. Some people hate it, some people love it. Also a good time to plug in our mid-year meeting. We are having actually an ultrasound course at our mid-year meeting. So I think, like you said, it's definitely becoming very important. So another question.
Yeah. I'll tell you, like, I'm sitting here at this desk having a meeting with you, and directly beside my computer today is actually this beautiful picture of the brachial plexus with all the peripheral innervations. I'm sorry, guys, it doesn't go away.
It doesn't go. I feel like I always think I have it down. Well, not all of it, but some of it down, and then I just forget it, and you just have to keep coming back to it over and over again. So it's good to know, even at your level, you still have to keep coming back to it. Awesome. Okay, and then so sort of going off of that, what are your sort of future plans and endeavors in the field of sports medicine? What do you see yourself doing, whether that be private practice, working with a team, that kind of thing?
Yeah, great question. I think as I was alluding to before, I certainly do have a lot of interests. So I think honing down on what that ultimate practice looks like is definitely still a work in progress. But yeah, I mean, ultimately, I'd like to be able to see, all comers with musculoskeletal slash pain pathologies, whether that's acute or chronic. So um, and also to be able to utilize, technologies at a pretty high level. So ultrasound and EMG, if there were to be the opportunity to do that, I would love to be in a practice where I could do both of those things. And just acknowledging as well, sort of the prevalence of back pain in our population and kind of the expertise that physiatry trained people have in managing those patients. I'm definitely very interested in including, spine patients into my future practice, and also using fluoro to help address, appropriately those patients who do have back pain and who need some sort of other intervention to help bridge them, I guess, to physical therapy and other things like that. So I'd like to be able to utilize all of those tools. And I know that that's for some people, it's less appealing to be able to use multiple modalities. They would rather just focus in on one thing. But I think that, again, is a great question to ask yourself during your training, whether it's medical student level or residency, is, what do you like to do in one given week? Do you like to just do the same thing over and over again? Or do you need to have a little bit of variety in order to really keep yourself mentally engaged? For some people, they just want to focus in and be super, super expertise level at something. But for me, I recognize that I need a little bit more diversity in order to be able to stay at my game, even if that, means that I'm probably not going to be the person who's doing the highest level, fanciest, cutting edge intervention. I would rather have a little bit more variety in my week schedule. So that, I think, is something that they don't really tell you about much in med school, is just really pay attention to, what it is that you like if you're thinking outpatient versus inpatient. And then if you're thinking outpatient, how many things do you want to do in a given week? What does that week look like? Start building like a pros and cons list in your mind, or even write it down on a piece of paper, because we spend so much time focusing on learning medicine that we don't spend enough time, I think, thinking about what it is that we actually like versus dislike in any given day. So starting to make that list early, I think, is only going to be a benefit to people. I don't know that I answered your question.
No, it does. And that's a great point. I think that's what makes, at least so far, what I've seen in the field of physiatry, that's what makes it so great. There's so much breadth, like diversity in the field of what your practice as an attending can look like, which is appealing to a lot of people. Sort of following up with that, you kind of mentioned interventional practice. So sort of to follow up with that, I know a lot of people have questions regarding, how do you go about learning procedures? Do you need specific training? Can that be in any fellowship? Can you sort of touch on that?
Yeah, of course. I think this is really confusing. I think this is confusing for residents who are trying to apply for fellowship. So I can only imagine, like when I was a med student, I kind of started to develop an appreciation for this, but it's this space and an understanding like what you need in order to do what thing is also constantly evolving. So whatever I say to you today, just make sure that when it comes time to you applying and really looking into it, that you do fact check it with, the latest up-to-date information. So, kind of as it stands now, if you are interested in doing, an interventional practice, there's a lot of different ways of getting there. And interventional, I don't want to just be talking here about sports medicine. I think it's, again, important to realize that you can be an interventionalist and do pediatrics or do neuro rehab, and really manage things like spasticity at a high level, using like phenol, using botulinum toxin, doing that with ultrasound guidance. You can really do a lot interventionally with PM&R outside of just the world of sports medicine, sports and spine and pain. So that's something I also have to say I didn't really appreciate. I thought when coming into this, okay, if you want to do procedures, it's probably going to be on the MSK pain side of the spectrum rather than it being on the neuro rehab side of things. But that's totally untrue. You can be very, very interventional on that side of the physiatry field as well. So keep that in mind. I think for doing the highest level spine interventions, which in my mind includes, injections in the cervical spine, and also contemplating doing things like, radiofrequency neurotomy, and also thinking about more high level neuromodulation. So inserting spinal cord stimulators, peripheral nerve stimulators, things like that. Typically the trend is that for you to be credentialed in as many places as possible, that it's probably safe to do an accredited fellowship in pain medicine. If your aspirations are to do EMG, ultrasound guided procedures, and just bread and butter spine injections, by that I mean lumbar spine, like epidurals, even some radiofrequency neurotomy stuff, but mostly is focused on the L spine as opposed to the C spine, and not really thinking about doing those procedures that would take you to the OR. As of now, you can really kind of accomplish that through a sports medicine fellowship versus a sports and spine fellowship. The challenge is that every single fellowship is a little bit different in what they offer. But I think, so you have to sort of do your research, which is kind of frustrating, because it's not like residency where you're coming into it and everybody's going to have a different flavor, but ultimately, it's the training is pretty much going to be checking all the same boxes. There's definitely a lot of differences in any given sports medicine fellowship, any given sports and spine. But I would say for pain, what is generally true is, they kind of own the world of spinal cord stimulators and neuromodulation and things like that. So if that's of high importance to you, that's probably, where you should end up. In terms of doing a fellowship versus not, I will say there's a lot of people who just go into doing interventional practices right out of residency. And that's definitely something to keep in mind. Fellowship is not something that you should assume that you have to do in order to be able to have like a very fulfilling practice. The challenges is, I think in general, the trend, if you want us to say, for instance, in the academic setting, or if you wanted to work in a really competitive market, having a fellowship under your belt, especially an accredited fellowship in some circumstances, can certainly open the door and make it easier for you to be credentialed. But it is not an absolute necessity in this day and age for you to have a fellowship to be able to do most of those things, with the exception of, the stims and those things on the higher level end of the procedural spectrum. And I think that's, very true for neuro rehab as well. You can go right out into practice and do spasticity management, but if you wanted to work in academics and really become the person who is doing spasticity in this big university setting for peds or whatever, then it probably is going to be easier for you to achieve that if you do like an ACGME accredited pediatric rehab fellowship. If that makes sense. So it's definitely evolving. I would say the best thing to do is to pair yourself up with a mentor who's sort of contemplated and who's advised people who are applying to that range of subspecialty areas to really get a sense as to what is necessary for you to achieve, the outcome that you're looking for in terms of career trajectory.
You hit so many points there that are so important, I feel like, and obviously confuse me. I mean, I'm just a medical student, but I'm sure they confuse even residents as well. But I had no idea either that you could do all these interventional things in pretty much any fellowship or any field of physiatry per se, subspecialty. So that's kind of new to me. So that's very cool. So as we kind of begin to wrap up here, we're going to transition into more general physiatry questions. So these are just kind of more fun questions. So what are some of your favorite moments as a PM&R resident?
Yeah, I mean, there's so many. It's hard to pick just one. But certainly I would say, the sense of community that we have here is awesome. And I really just loved, even between like the patient care situations, which are usually very rewarding and wonderful in and of themselves, but just being able to spend time with my co-residents, whether that's in the workroom, writing notes, or, just outside of work, going on a hike. It's really nice to have a group of people that you're kind of going through that experience of residency with. So definitely, in applying, try to find a place that hits that like culture and sort of sense of community as well, because you're going to be spending a lot of time with those people, and it definitely can be very, very rewarding and wonderful too, outside of the clinical care stuff.
Awesome. So along your journey so far, have there been any moments, anything that's caught you by surprise about the field that you feel like you hadn't known about before? I think we touched on it briefly before, but yeah.
Yeah, I mean, so many things. I think PM&R is just, it's so complex and it's such a broad like a broad field, I should say. It's really difficult to capture all of that without really having, at least I felt this way, at least having done the job of being a resident. So I would say, as a med student, what was really helpful for me, it started to get me there, was doing a rotation in place where I could do a week of brain injury, a week of spinal cord injury, a week of MSK, just trying to get a sense of that breadth, because our field is really unique in how many things it has to offer. One of my favorite kind of quotes, I guess, and I just heard it kind of in the ether over the last couple of years, so I can't attribute it to any one person, but I remember very distinctly somebody saying, physiatry is the generalist specialty. So you're the ultimate specialist generalist if you're a true physiatrist, because you can see anything with, medical deconditioning, neurological deconditioning, or musculoskeletal pain. Like those are in and of themselves hugely complicated and in pediatrics, right? Challenging topics. So it's what's incredible about PM&R, and what's continued to surprise me is how true it is that you really are expected to know a fair amount about a whole lot of stuff. And that in and of itself is really empowering too. And I think I would say to anybody who's interested in PM&R, really keep that in mind, because I think the trend of medicine in general is that people are trying to become more and more so specialized into that one thing. And that's wonderful. And I can appreciate why that's becoming the case. But if you're somebody who likes to have their hands in multiple different pots, or who likes to think more broadly about things, which I think is a quality that a lot of people tend to have if they go into, say, family medicine or internal medicine, PM&R can be great, because in general, PM&R can be great because you can see so much different stuff, and you can serve such a wide patient population. I think that's really cool. And it has continued to surprise me how much that's been true.
That's awesome. Yeah, I think I didn't even realize it. I think some of this is new to me as well. I sort of had this impression that PM&R was very just MSK neuro, which are two of my favorite things. So I thought so it kind of makes sense. But the more I listen to you and other physicians speak about it, the more I realize that you do have to have a very good knowledge of everything. So that's a great point. Let's see. So this is, I guess, this is sort of a chance for you to plug your residency program, but what's kind of the rundown of the residency program in St. Louis, sort of PGY2 to PGY4?
Yeah, absolutely. I mean, there's so many programs out there. And I think the good news is that wherever you end up for residency, it's all accredited by the ACGME, which means that, like, ultimately, if you match, you're going to be okay. You're going to get the training that you need to be successful. So I think our program has a lot of things that are pretty unique about them, especially in terms of our schedule. So we definitely have, in terms of PGY1, half categorical, half advanced positions. So there's some people who will come here for PGY 1 year, and we have a great PGY 1 year here. But then we also do encourage people to explore and go out and do a PGY 1 year if it's surgical or otherwise. That might be, again, directly in line with the things that they want to learn. So we're not forcing anybody to stay here for their intern year. In terms of your actual PM&R training, the PGY 2 to PGY 4, in general, people have to do 12 months of inpatient rotations, which is, I think, policy that is per the ACGME. What I think we do really well is, as the PGY2 here, you're not entirely going to be just in the inpatient rehab hospital. You will be spending quite a bit of time there, but you'll also have the opportunity early to get exposure to, again, the breadth of physiatry. So you'll be able to do electives as a PGY2 and MSK, pain, peds, neuromuscular medicine, all of these things, because again, our field is so broad and so complex that I think the philosophy of our program director is really to make sure that the trainees here get exposed to that as early as possible, so that they can start to make decisions in terms of, what it is that they like and that they don't like. And for a PGY2, looking at, do I like inpatient? Do I like outpatient? Do I like clinic? Do I not like clinic? What kind of clinic do I like? So being able to have the opportunity to ask yourself those questions early, I think is really beneficial, not only for plotting potentially future fellowship, but also for plotting what it is that you want your actual life to look like. Because again, we're not planning to be residents forever. This is just a stepping stone to that ultimate job. So I think we do a great job of positioning people early to help them understand PM&R and start to make decisions about their lives. I would say the other thing, we do have a pretty supportive community here. I think if people are interested in doing research, or people are interested in kind of having all the resources of an academic center, WashU is a great place for that, because there's somebody who is at the top of their field literally doing research in pretty much anything imaginable here. So as a trainee, even if it's not directly physiatry adjacent, you can approach any PI or any attending across the university system and be like, hey, I saw that your research on the website looks really interesting. Can we talk? I might be, I'm looking for a project. And I found that the community here is really exceptional in accommodating people. And I think that's a huge, huge strength, because you need to be, in order to be able to, again, meet your career objectives, or even start to develop like what those are, like having opportunities like that is really critical. And that's something, again, that goes outside of that, ACGME mandated specific rehab curriculum. Like those are those intangible other things that you probably don't know about unless you ask. And then the other last thing I'd say that I think is a big strong suit here is I think early access to just exceptional mentorship, which as a student, having gone through, all of your training so far, having people that you can rely on who can give you, their perspective on the world, and also help you understand what it is that you need to become successful, and also help you explore informally what your options are in terms of career stuff is invaluable, really. And I didn't necessarily appreciate that about WashU coming in, because I didn't know to really ask that question about mentorship. But I think mentorship in general has gotten a lot of attention recently through social media, but I would encourage applicants to ask a lot about, like, what does that structure look like? Who is out there to give me advice? And I think WashU has a lot of really great people to give you advice and to position you for, developing your future career.
That's awesome. And I think, you're really touching on mentorship, which is key, I feel like. And sort of the perfect segue into our next question, which is sort of, because PM&R is sort of a small field and it can be difficult to gain exposure as a medical student, especially now with COVID, or within the last 2 years, really, with COVID. I feel like students are struggling, even if they have that interest, they just struggle to get any actual exposure. So what advice, of course, there's mentoring, like you said, what other advice would you give a student to really gain insight into the field?
Yeah, it's such a challenging time. Certainly it's more difficult, I think, than it's ever been, in the sense that, it's becoming really competitive, and then seemingly there's also less access because of the pandemic. But I'm hopeful that that will change, in the next coming years, in terms of conferences and things like that becoming more available because of the, pandemic, hopefully winding down. But if certainly you're looking for an elective exposure, and you say you can't get that elective because of COVID or other restrictions, great resources tend to be the professional societies, like, your professional society that you're involved with, whether it's, AOPMR also, or AAP, I think do a really great job of being all encompassing and really helping medical students as well, not only understand what PM&R is, but also there are programs available through AAP and AOPMR where they set you up with a PM&R mentor who shares, some interests to you, or not, just a person who can be a good sounding board, if anything, across, a variety of institutions in the country. So that to me is a really, really invaluable resource in this time where you may not have access to the traditional rotations, but I think that will change. And then the other thing too is certainly social media has become a very interesting space. And I think physiatry, med ed, social media has really, picked up. And I think there is the opportunity there for people who are interested to, follow, some of the more active accounts. And I think it's not the same thing, by any stretch of the imagination, but at least it's some window into the world of PM&R and like what people are like and what people are interested in and what they're posting about, can also serve as a kind of a unique window into the world of physiatry. But yeah, and I would say a lot of people in that social media space are also pretty open to, messages from students who are looking for mentorship or looking for connections too. I know that I've reached out to people, being a recent fellowship applicant, to the same end, trying to look for advice and just general information, and use social media to my advantage for that.
I think you touched on some really important things there. And I want to ask a couple more questions. I don't want to take up too much more of your time. But from my personal experience, I completely agree, especially in med Twitter in the physiatry world. Everyone is so friendly. I was so surprised by how friendly everyone is. You just like, everyone's following each other, everyone's conversing. But I do have a question. As a student, it can be pretty overwhelming. You're reading these things, you don't have a lot of knowledge, you don't have a lot to offer the field per se yet. So what is sort of your take on how a student can use social media to their advantage when it comes to matching and all of that?
Yeah, that's a tough one, Daniel. Honestly, I think this, there's no clear playbook or rule book as to how to behave on social media and how to interact with others. I mean, before we get into how to use it to your advantage, I think, the ground rules are very, very clear. Anything that you write on there is going to be on there for posterity, and you want to make sure that your grandmother and your future children are all going to be, very much willing to read that and 100 years from now or tomorrow. So, just obviously using the utmost decorum and professionalism, goes a long way. Yeah, I think in terms of how much students can use it to their advantage, it's tricky because you don't want to be overbearing on somebody and you don't want to reach out to them necessarily and put them out. But in general, if it's somebody who's engaging a lot on social media and they, you can always reach out to them with a message and say, hey, would you be open to talking? And certainly they can always ignore you, or they can always say no. And just, I would say, just not be presumptuous about it. And generally people, I think, are going to be pretty welcoming. That being said, it's by no means required to reach out to people on social media or to engage with programs on social media or to retweet programs on social media. I think a lot of people feel pressure to engage with those leaders or engage with programs, especially now through these virtual application cycles. That's not going to change, or shouldn't definitely change, the way that people see you. It's really going to be your application and your interview that's going to matter in terms of your, candidacy for a particular residency program. I would say to use it more as a information gathering tool more than anything else, rather than using it as a way to sort of, I guess, change, or think about how it would change the perception of you versus the program, with the one caveat being that obviously if you're going to post anything, it should remain as most professional as possible, because if anything, I don't think it's going to necessarily improve your ranking status or your ability to match successfully. But if anything, it could potentially detract from it if you were to post something that was, conceived as being unprofessional. But of course, I think most people know that already.
Yeah, that makes a lot of sense. Yeah, thank you for that. I think, like you said, social media is just becoming so prominent, and it's, for a lot of students, it's intimidating because they feel like there's almost this pressure to, you have to be on social media, you have to be on Twitter, or else you're like almost at a disadvantage compared to these other people who are interacting so much. And like, you have residency directors retweeting their stuff and they're like, oh, this is, so that's good to know.
Yeah, I think it's really complicated, right? I mean, like, what does that mean? A retweet, is that an endorsement? It's definitely a space that is a little bit challenging to navigate. But, there's a lot of residency programs that are not on social media. There's a lot of them who don't have their program directors on social media, who are not actively engaging with candidates. And I think that's fine. So I would treat it as, like I said, information gathering, and potentially a way to reach out for more, for mentorship and things like that, but not necessarily stress out about whether or not, or what the meaning is behind somebody, replying to you in like this very public space and retweeting you. I would not put any pressure on yourselves to feel like that's an important part of your application to PM&R. And the one thing that I'll say to your point before is like, how do people get engaged now that things are more virtual? I would say the only other thing that I think I failed to mention is not only looking for mentorship through the professional societies, but if there's an opportunity to get involved with, like say, a medical student council or a committee with one of those professional organizations, even if it's not AP, AOPMR, or any of the like super big societies, even if it's just, a society that's more near and dear to your heart, or something that's more directly in line with your, say, future interests, say it's like a brain injury society or a neuro rehab society or a pediatric society, all of those things are going to not only help you network, but they're also going to expose you to people who could potentially serve as mentors. So that's, I think, also very powerful now that there may be less in-person interaction.
Yeah, absolutely. Great point. Well, this has been an awesome conversation. I feel like I've learned a lot, which is great. Now, you're a very resourceful person. You have a lot of insights. Is there anywhere where people can reach out to you?
Yeah, so to our point on social media, I'd be obviously happy to connect with anybody on that platform. I'm on Twitter, kind of on a more professional, like public way. So certainly people are welcome to reach out to me there if they have any questions about our program, about fellowship, about physiatry match in general. I'm always happy to speak. And if I don't know the answer, I can hopefully connect you maybe with somebody who does. But that being said, yeah, good luck to everybody out there applying. You'll be fine. It's just I got to take things one day at a time, and physiatry is really lucky to have people like you, like interested in our field, right? And Daniel, you as well. Thank you so much for putting this together and really spreading the word about PM&R and what you can do with this specialty, because I think that's really what's gonna be the future here, is making sure that we get people who are interested in it for the right reasons and who really gravitate with the ethos of physiatry. And so I'm just really excited to have been here today.
Absolutely. Thank you so much. Thank you everyone for tuning in on this episode of the AOC PM&R podcast. My name is Daniel Valdez. I am a second-year medical student. Thank you again, Dr. Fogarty, for joining us in today's episode.